So this chapter is entitled The Safe Transport of Pediatric Patients. And this is a new topic that the state just came up with. It's actually a good topic because it was being done wrong like this for all the years that I can remember. So this is now usimidaraisa, all right? This is no longer permitted in plain English. And we must never, ever allow a child to be on mom's lap with mom having the seatbelt and just holding on to the child. So this is something that we are not allowed to do anymore. I don't think we were ever allowed to do it, but it was being done. And we're going to talk about the different techniques for transporting little ones. So mom holding a baby, that's a no-no. Okay, so just like you wouldn't do it in a private vehicle, okay, every child's supposed to be in a age-appropriate car seat. It is illegal in your personal car, and you can't do an ambulance either. So very important that people, the old timers and the dinosaurs, that we move on and we do things correctly. So the best way to transport a child in an ambulance is in their own car seat, all right? Their own car seat, as long as it's the correct size and it has the correct padding or whatever for the size of the child. That's the way to transport them. The car seat can be attached to a chair in the ambulance, and we'll talk about which chair or direction that should be. But it's very important that the child fits to that car seat. So when I became an EMT a couple of days ago, they told us that if the car was involved in an injury, right? The car was involved in a collision, that you had to chuck the car seat and it couldn't be used. In 2012, the National HTSA came out with a document and said, Lav Davka, not necessarily true. Okay, so they said that if there is no visible damage to the car seat, right, it doesn't matter if the car was completely totaled or whatever, but if the car seat was undamaged, then the car seat's fine and it could be safe. So it's not the way it always was. This document came out in 2012. And yeah, you could consider using the child seat if there's no visible damage.
Leo, is that national?
Yeah, national, yeah.
Interesting. I was just on an MVA last Friday, and the Broward Sheriff Department said that the boosters that were in the car were not going to be able to be used anymore.
So, where do we place the child in the ambulance? Okay, so we've got the child, they're in a car seat, okay? And look what I wrote here, that the airway or the captain's seat, that's the one directly behind the driver usually, that'll be the best place, okay? Now, you could secure it in a forward-facing bucket seat if you don't have a bench. But it should never be placed on the bench, okay, or in a side-facing chair or seat. So if it's a rear-facing car seat, then you can't put it face forward. You've still got to put it rear-facing, okay? So if it was rear-facing in the car, it's going to be rear-facing in your ambulance, meaning the baby won't be towards the back of the ambulance. And then at the bottom, I write about the familiarity of the child. It'll make them less anxious. The look, the smell, the contour, they're familiar with it. So it definitely would be the best option. So there are commercial devices, okay? We carry some, we don't carry all of the different ones, but we do have some that we carry. So this is a larger child, and definitely this can be attached to we carry something like this, and we would strap the child into this. It's a proper 5-point harness, and it's safe, and that gets attached to the stretcher, and whichever adult is accompanying would be able to sit right next to it. This is some different styles, so these attach to your stretcher, and pad the voids, etc. This NHTSA says you should use 4-point straps. 3-point is or a 3-point strap designed for children. So these are we have one of these styles, and the child should be snug onto the stretcher. Okay, so at the last time I did this, there was big discussion about tiny babies and neonates, okay? Because you understand that a neonate cannot fit into these. These are for larger children, maybe 3-ish and up. Okay, so what do you do with a 5 to 14 pound baby? Well, there is a neomate, it's called, and it's a pediatric restraint system. And this is what we should be using. Definitely not mom and seatbelt and holding it. Okay, the halo thing holds the baby's head, and it's easy to strap to the stretcher and easy to strap the baby in. So this is the way we should be doing it. I don't think at this time we carry one of these, but if you just think of all the babies that we deliver over the years, and then we take them with mom to the hospital. So we personally don't have the correct equipment for that, but this is what should be used. So in conclusion, well, I just mentioned this. A lot of the ambulances have this for an older child, where the captain's seat flips down and you'll have a whole seatbelt situation harness. This is good for an older child, right? Like this one here. But obviously no one in the ambulance, parents, caregivers, medics, passengers, EMTs, no one should be unrestrained. Plan ahead, make sure that whatever position you want your patient to be in, make sure that you have the correct equipment for restraining and keeping everybody safe, because at the end of the day, you're the one that's in charge, and you're the one that is got to make the right decisions for these children.